Hello, I am Susan Baumgaertel, and welcome to Navigating Your Health with myMDadvocate. This is episode 1, and it's called I Can't Find a PCP. So, as many of you know, physicians have been retiring or resigning from the healthcare industry in large numbers, and just putting a greater burden on those who remain. And more frequently, it's a challenge to find someone who's actually taking new patients, especially in the primary care world. And boy, it sure is a daunting process to call around only to be told the next available appointment is 6 months out, 9 months out. Or worse than that, the wait list is for 1 year, or there's no wait list at all. So this is a very common scenario nowadays many of our patients are facing, and that's pretty unfortunate. So the same scenario exists for specialty referrals too, and actually with some large medical centers in the greater Seattle area closed to new referrals. That was a new one to me just recently, so wow. So what is going on, and how does a patient find a new primary care physician? So I'd like to start just really kind of giving 5 loose patient stories or scenarios. The names have been changed and things have been kind of, genericized, so I don't violate any privacy rules. So the first person is someone named Lucy. And Lucy is from out of state, 5 states away, and they moved to Washington State and really was unfamiliar with this region. And so they needed a PCP urgently. They were on so many prescription medicines, I think 25-ish, obviously from some specialists as well. And, first things first, prescription refills, you don't want to run out. So they needed to get into a pain clinic, and oh my gosh, I don't need to tell anyone how hard it is to get into a pain clinic these days. And they also needed to start looking for multiple specialists and other medical professionals to complement all of their care. So finding a primary care physician was the first leg of the journey, but boy, there was quite a time frame we had to commit to. The second patient is Sarah. She's in her mid-70s, lives in a remote area of Washington State. And literally, it's a day's journey by car or slightly less than a day's journey by plane if you count to and fro. And all that just for a 15-minute visit. So you can believe it was unnerving to think about spending a whole day just traveling for a quick checkup or a quick visit. So she uses me as a consultant to decide if care is needed, which is appropriate. But really, we're working together to find a primary care physician who can meet her needs, especially remotely. So that's really key for her in terms of access. The third patient is Nancy. Nancy's in her early 50s. She's very busy, professional. She travels extensively for work. I think she's here half the time. And lives in the Seattle area, the greater Seattle area, but also has a sick relative on the East Coast. So there's lots of back and forth and kind of lots of angst and decision-making involved with that. So she definitely needed timely access to a primary care physician, and certainly did not need to have stress and more hassles. And so kind of paving the way or the handshake, as you may, to make that happen was really key for her. Also needs a dependable partner and someone who can advocate for her going forward and navigating that, not just the primary care part, but other parts of her medical needs. The fourth gal's named Kim. She is in her late 50s. And she really needed validation of getting into a regular medical care setup in a proactive fashion, thinking about the future. So very interested in finding a primary care physician who blended with holistic and complementary care. And, she already gets this, so she wants someone who has an open mind, and that's not always easy to find. And, she's healthy now, but is fearful of kind of the future, and if she ages and something happens to her, how is she going to get care and what is she going to do? So very valid concerns for really anybody. And the last person is Julie, and she's in her late 60s. She was told after her previous primary care physician left that nobody is covering, and that was a shocker to her because it had been quite a while, and frankly, she needed refills again, and really was not given any help or hints at how to get in with another doc again. No fault to my colleagues. They are working their butts off, but it's, I think, more of a system problem with, the great resignation and, dare I say, the pandemic, but certainly with people retiring and moving. So, she just wanted to get her prescriptions refilled. What a simple request, only to kind of get that brick wall that comes up. And actually, she was interested in DPC, which is an acronym that stands for Direct Primary Care. And there are quite a few practices, DPC style practices in this area, but she couldn't get in. And so again, kind of needed that handshake, needed to explore options with me in terms of how she could really latch on to a good primary care doctor. So, sadly, these scenarios, probably are not far-fetched. They are becoming far too commonplace. And, physician retires, or they resign, or they move away, life circumstance, and, they can't get in with another physician. Literally, it just, you would think that would be something that should be automatic. I'm sure it's even more difficult in rural areas. So I know I live in a large urban area. But, offices are woefully understaffed. Oh my gosh, that cuts across all medical professions in every way. We know that. And, patient calls and portal messages, my charts and that maybe aren't returned in a timely fashion, not because people don't want to care for them, because there's no staff. And that's a strain on the system, but truly a strain on the patient who often, gosh, it sometimes gets to the point that they're frantic and they really need help and they just don't know where to turn. So, frustrations mount as medical issues get put to the side, because of who has time. And, prescription refills are overdue, and it just kind of layers and adds up. And boy, add in insurance changes and the pandemic backlogs. Often they're told that the next appointment's 6 months out, which, gosh, that's half a year. It's hard to believe. So, what to do about new or urgent, medical problems? Is it safe to wait? Maybe to the medical profession, these are very simple questions to answer, but honestly, that's not the case when you're the patient and you're kind of wondering what to do. So my most frequent questions really from patients are about getting in with a new primary care physician, and often with specialists too. So this is kind of the top of people's lists. I don't have a magic wand. Boy, I wish I did. I can't just kind of go like this and appointments appear. But I do know systems, and I think that's the value that I can bring to the table that patients may not have on their own, frankly. There are a lot of things to consider when you're looking for a primary care doctor. So first maybe is geography. So where are you and where are they? And is it easy to get to? And access is important, certainly remote access as well. And then, hospital systems. So if you want to be attached to a certain hospital, is that new physician going to be? So those are important things to plow through. And then, dare I remind everybody about insurance coverage. So you got to make sure they're covered. And that's just one more hoop to jump through, I think, which again makes this whole process daunting in so many ways. So I can serve as a buffer of sorts. I can fill the gap when it comes to talking about medical concerns and kind of where to get care or where best to get care, and kind of guide people in certain directions. And I think that that's of value in so many ways. I think it is, and my patients certainly echo that back to me. I can scout out practices. I can often help to make that connection. And again, that's really sometimes priceless. So I can serve as an ally to the patient's new primary care physician, once they get somebody, and their entire medical team. And the most important thing, honestly, is I am very collaborative, not competitive. And I think in this day and age, we definitely need more supporting each other, more collaboration, and more kind of positive energy in that regard. So, gosh, thanks for listening. I hope you enjoyed spending a little time learning about the challenges of finding a primary care physician in this region. And I hope you'll join me again for episode 2, which is Why is my diagnosis? Actually, what is my diagnosis? I guess why, probably. So have a great day, and thanks for joining.